Hello, our Capstone project was on early recognition and intervention of heavy postpartum bleeding before progression to a massive hemorrhage in the postpartum unit. My name is Sydney Hedrick. I did my preceptorship at the Family Birth Center at Auburn Medical Center. I became interested in this topic because on one of my clinical shifts during my preceptorship, I saw a postpartum hemorrhage in one of my patients. So it was really interesting to see how the process unfolded, how many people were involved, the steps once a postpartum hemorrhage actually occurred. So I really wanted to know more about this, what caused it, how to prevent it, and just know more about it.
My name is Nicole Rector. I did my preceptorship on the mother-baby unit at St. Joseph Medical Center. And I thought this topic was really important and interesting because we do a lot of maternal assessment on the floor and we always check for bleeding. And so it's important to know how much bleeding is to be expected and how much bleeding might require an intervention. And so while we were doing our research, we found that postpartum hemorrhage is the leading cause of maternal mortality worldwide, and it occurs in about 3% of deliveries in the United States. But something we found very surprising was that 73% of deaths related to postpartum hemorrhage are actually avoidable with standard care.
Some key takeaways from our project. The first one would be that a lot of patients are unaware and have never heard of a postpartum hemorrhage. So there's definitely going to be a lack of education. So as their nurses, it's really important to educate moms and significant others, whoever else might be in the room with the mom, in order to help prevent postpartum hemorrhage. It's, another set of eyes to be looking for the signs and symptoms. And then a second key takeaway is that the main interventions to prevent this are the prompt infusion of oxytocin and then uterine massage after birth. And those are the key factors in preventing a postpartum hemorrhage. However, not a lot of research has been done on this topic, so we really need more information before we can make a formal change of practice. And things that were reinforced during all of our research were definitely that most postpartum hemorrhages can be prevented with standard care. And like I said, there hasn't been a lot of research, surprisingly, on this topic, so more needs to be done. And for me personally, what I saw during my preceptorship in practice was that my nurse was very oriented and aware of postpartum hemorrhage. She was very prompt with uterine massage. She never was, she wasn't even a minute late ever. So it was really interesting to see that. But she also had opportunity to attend a postpartum hemorrhage clinic. And I think a lot of other nurses haven't, so they're not as well versed on the topic. So I think there's some education for nurses, but there definitely needs to be more education to prevent this further.
What I saw in practice at St. Joe's is we did a lot of fundal massage during our assessments. Every single assessment we used fundal massage just to assist in the uterine contractions. And then also every patient came down after their delivery on IV Pitocin just to really ensure that contraction. And then there were hemorrhage carts all over the unit just in case a postpartum hemorrhage were to occur that included all the necessary equipment and medications. And then a question that we have been asked is why postpartum hemorrhage and the maternal mortality rate in the US is so high compared to other developed countries. And that question is very hard to answer because there's a lot of need for improvement in the US in various areas such as access to healthcare, socioeconomic barriers, the policy-making process. So there's just a lot of room for improvement in the US healthcare system.
That concludes most of our presentation. We would like to thank the Pacific Lutheran University School of Nursing, the Multi-Care and Franciscan Health Organizations, and then especially Professor Morrison. She oversaw this project and gave us lots of recommendations along the way. And then I would also like to thank my preceptor at Auburn Medical Center, August. She was awesome. She taught me a lot. Yeah.
And I'd like to thank my preceptor, Melissa. She really taught me almost everything there is to know about postpartum, and she was very encouraging while she was teaching me. And thank you everyone for watching our presentation.
Thank you.